to talk to the HSSM class, and this is my intermediate lecture on action research, and this is specifically tailored for HSSM, and I'll be very glad that we are able to internalize whatever we are going to discuss today. First of all, just remind us that the definition of terms. Action research is a process in which participants examine their own practice systematically and carefully using the techniques of research. So therefore, action research is therefore a research that anyone of on his or her own practice to improve it. And for this case, you as HSSM students, therefore, it will be very important that we do what we call institutional diagnosis. Like you analyze what are problems that the institution may encounter. How can you help the institution to cut cost? How can you make the institution be more efficient in running its daily activities in service delivery or product, any product that institution may be producing? So action research in HSM, this is typically designed and conducted by practitioners. When you're talking about action research in HSM, you're talking about we are imagining that now you are practicing your career now. So it is typically designed and conducted by practitioners. This is HSSM practitioners who analyze the data to improve their own practice. Which type of data are we talking about? Let's look at the data like water bills, electricity bills. That is the data that you have authority to access and analyze. Like, is the expense, the water bill increasing or reducing? Is electricity bill increasing or reducing? And then what is the problem? And one of the triggers of problems, such as when you're talking about electricity bill, is like we are looking at lights being left on for too long unnecessarily, the printer printing unnecessary items. Let's say in the hostel setup, like the hostel staffs, how effectively are they using the available resources in their day-to-day work? Action research can be done by individual or by a team of colleagues. So that means that it is not you alone as a HSM practitioner who can do that. You can do that together with your colleague, maybe across the departments or within your department. Action research has the potential to generate genuine and sustained improvement in institutions, such as trying to cut water bills down by making sure that there's no leakages, cutting the water bill, the electricity bill down by ensuring that the machines that are being used are running and are working efficiently. The bulb are not left aimlessly on, off, and people are not using electricity in an unproductive way. So that is very important, and maybe make sure that the machines are not defective. And even when looking at in terms of how much much money the institution is using on furniture, then you can look at that in terms of the quality of furniture being bought versus the quality of repair that is being done as well, and how many furnitures are being replaced. And that one can be analyzed, and then you'll say that if we buy this type of furniture, then we will not require more repairs or something closer to that. So why has not cost MTC emphasized on action research to HSSM? So action research gives HSSM practitioner a new opportunity to reflect on and assess their practice. For example, I was talking to your HOD today, and he said that one of your biggest role, which you're going to see later on, is that to ensure that things are running efficiently within an institution. Ensure that the institution is cutting costs on its daily operation. The institution is running efficiently in terms of service delivery or product delivery in that case. So HSSM, as a practitioner, you have a very big role to ensure that everything is working smoothly within an institution. And to be specific, a health institution or whichever institution you're going to be employed. And also to explore and test new ideas and method and material. For example, if you are using let's look at the new things that are coming up in the market in terms of cutting costs and ensuring that electricity is used effectively. Like, do we have earth wire? Do we have also that you ensure that the machine are running and you are not electrocuted while working on that? Or other thing that I'll think about is that coming in terms of plumbing, there are new things, new pipes that are so good that they are not breaking in aimlessly, like PPR pipe. Compare with the normal PVC pipe. How long and how long will they take to start leaking? The PVC pipe, of course, has its own challenges. PPR pipe has its own challenges, but the PPR pipe is coming up in the market and is replacing the PVC in a way that less joints are being used and less leakages meant to be experienced compared to when you're having a PVC pipe. And there are also so many things in terms of electricity consumption that are coming up in the market, like smart socket that switches themselves on and off, um, circuit breakers that are out there, so that when electricity is used beyond a certain limit, the circuit breaker just turns off everything, and that will help the institution cut costs really. So, to assess how effective new approach, of course, that is a new approach to share feedback with fellow team members, and maybe let's say you have come up with a new thing, like if you are going to use PPR pipe rather than PVC pipe, we are going to cut costs. So you can share that one with your team or with the management that let's use this type of a pipe so that water will not have several repairs and will have minimal leakages. And to make a decision, switch new approaches to make decision about which new approaches to include in the practice. And of course, this is a very good thing for you as a HSSM guy out there, that you will help the institution cut costs, and that one will prove that you really are supposed to be employed to that institution because you're helping things run smoothly and helping the institution cut costs where necessary. So how is action research done? And action research, of course, is done entails planning, acting, observing, and reflecting. It's cyclic. So using a cyclic or spiral process, which alternates between action and critical reflection, and continuously refining method, data and interpretation in light of the understanding developed in the earlier. So let's say you have changed the pipe to PPR. So the whole institution's plumbing system is using PPR pipe. Then you can now do your analysis and say, before the PVC pipe was replaced, this is how much water bill was used, and this is how much repairs was done, and this is the money that was used on this, and this way. And then after PPR, then later on, after PPR has been installed, then you can now analyze the data. Are water bills reducing or increasing? And then you can have this formal discussion with the management. And then the management can now say that they really have made the right decision in trying to implement your idea. And this is where now you come in. So the problem is only one phase in which to enter. Like you have identified a problem. That is one way you can start your research. You can also like collect data. And if you see that the data is very abnormal in terms of water bills, electricity bill, you realize that another month the electricity bill is high, another month the electricity bill is low, then that one can trigger you to start doing action research. Evaluating existing data. You can evaluate, like say at North Coast Medical Training College, the bills for the last 5 years and the current bill are really the same. What has changed? And is there anything that you can do as an HSSM guy to improve the way things are done? And then taking action. It can also be a point of entry, like you start doing something, uh, you start implementing a new idea, and then see that how that new idea will impact the institution in terms of efficiency, and in terms of the outcome. And in terms of outcome, I'm just saying, how will that new way of doing things how will it help? How will it help the institution to run its own operation efficiently? And those are ways that you can be able to do your action research. And that what as you can going to as you're going to realize that action research cannot be done. You can decide to do it alone if you are the only HSSM person. If you are a team, then you can decide to do it as a team, or you can also involve other department in doing your action research. So let's look at participatory action research. Participatory action research involves all relevant parties in actively examining together current action, which they experience as problematic in order to change it and improve it. They do this by critically reflecting on financial, technical, economic, geographic, and other relevant contexts. It aims to be active team research by and for those to be helped. It cannot be used by one group of people to get another group of people to do what they think is best for them. Action research is generally democratic or non-coercive by practitioners for practitioners. So, what are the characteristics of action research? It is an emergent process which takes shape as understanding increases. So, which means that as you understand the process, then um, you're still able to do whatever you're doing. It's of course. What do you mean by this? It means that as you do your action research and as you try to implement new ideas, then it means that that thing is still goes on, and you still and that helps you to perfect the way you do your work and the way you do your work, and that makes and molds you to be a better person because you are able to think outside the box. How am I supposed to do this thing? How am I supposed to improve this so that really my work can go on and the institution can maximize on profit on the resources that it has invested in? It is interactive process. Interactive, I'm sorry for the spelling. It is interactive process in which convergences towards better understanding of what happens. You don't do it alone. You have to involve people when you're making some of those decisions. It is participative. Change is usually easier to achieve when those affected by the change are involved, and qualitative, meaning that does it bring any change or does it bring is it not bringing any change in terms of the outcome of whatever you are implementing? So why do we have to do action research? Of course, like I said, it is participatory. It is from within and not from an external expert eye, and very real presence, and can emerge in the dynamically unfolding relations, which can teach us new ways of conducting our practice. So I'm trying to see what the scope of action research in SSM. Um, like I said before, I had a discussion with the HOD, Mr. Oscar, and he told me that one of their biggest role is to ensure efficiency and effectiveness of how resources are being used. And resources is not limited to tangible resources, but also untangible resources like water, electricity, and time. So reducing institutional expenses through repair and maintenance of company equipment, utility, and consumable. Of course, how much expenses can the institution reduce? How is it able to run its service efficiently in terms of having furnitures, the right quality, the right time to be repaired, because you don't have to wait for too long for some of these things to be repaired, because if you wait for too long, then some of these things may become obsolete, and they may need to be disposed of. Efficient time use in service and product delivery. So time, how much time is being used to attend to a patient? And is there a way that this time can be utilized efficiently or can be reduced so that the same outcome can be felt, let's say, on the patient or on a certain service that the institution is delivering? And this is very important. And this will help you as a HSM. You have to know your job description. What are you employed to do? And are you able to do what you are employed? Are you able to improve on what your job description entail? And this is now action research is coming in, that you continuously try to research on how effectively can you minimize some of these problem within the institution, such as expenses that are unnecessary. So this is very important that you understand why you have to do action research, and you have to limit yourself within your job description or go an extra mile so that you ensure that the institution is saving on cost and you are doing your job to the best of your ability. And of course, trying to ensure that you are, as a HSSM person, is trying to help the institution, of course, maximize its profit and able to do its service, give its service efficiently. And this will ensure that the beneficiary of those services are actually happy and will always be coming back and referring others to that same institution. So, of course, when you have identified a problem, you have to do what we call a CAP study. CAP study, K standing for knowledge, A standing for attitude, and P standing for practice. Does the institution have the knowledge that there is a problem out there? What attitude does the institution have towards such a problem, and what practices can be done to help that problem be solved? So the study, it serves as an educational diagnosis for the community and or the institution for this problem. So when you're doing also problem analysis, you can break the problem into smaller bits, like having the main problem and then breaking it into a sub problem, and then having it as breaking the sub problem into problem A or problem B or problem C. And this way you'll be able to come up with, you will be able to, after doing your problem analysis, of course, and breaking it down and theorizing what will be the probable sub problem within the main problem. Let's say water leakages. Maybe one sub problem might be the quality of the pipe. What would be the other sub problem? Think about that. Maybe they were not dug very nicely deep, they were very shallow. That's just another sub problem, shallow digging of the pipe. And then the other problem to be the quality of the plumber. Was the plumber able to do his work perfectly? The type of glue he used, was that glue really a good glue for making sure that the pipe don't leak? And that would be very nice for you to understand. So how do you collect your data? Of course, you can use a questionnaire, you can observe, you can document, review, like go to the accounts and see how much water bills were being paid for the last one year. Are they consistent? Have they started rising of late because of the leakages? Okay, how many complaints have been raised by the staffs concerning water shortages because the water is not reaching a certain area? And that will be very important for you to do. How to collect institutional data. Sometimes you may require to collect data from the management or the staffs. Of course, the first thing you need to do is to book an appointment with the authority and introduce yourself and state your objective to the authority and maybe the institution, and collect data and thank the institution for or the community for that case. And for this case, we are talking about the institution for their cooperation. How to handle data? Of course, you get the mean, you can do the mean, you can do the mode, you can do the range. And you see what the mean, how you know how to calculate the mean, and you know how to calculate the mode. And the mode is the most frequently occurring value, and the range is the maximum value minus the minimum value. So let's say the water bill for the year was 1,000 this month, and then there was another month where the bill was so high, 12,000. So what would be the range there? And then the mode is the most frequently occurring value. Most of the time, the bill has been 3,000, 3,000, 4,000, 5,000, 6,000. But what has been the most recurring figure? The mean. You take, if the mean is annual, then you get all the total bill divided by 12. Then you'll be able to get the annual meter bill, water bill for the institution. and then you'll be able to conclude from there. Developing intervention. Prioritize when you're developing intervention, is like you're trying to look for the solution to the problem. And of course, prioritize most pressing problem. Let's say the most pressing problem is water leakage. So what is the problem there? Change the pipe. Work from what the institution management know. Of course, they may know, you may know that water pipe was the wrong pipe that was used. We have other pipe in the market that are available in the hardware, but in Amazon you also have other pipe, but the institution does not know, and maybe it cannot afford. And then clarify the misconception and belief. Maybe the institution thinks that the PPR pipe is expensive and you cannot work with, but you can tell them that it's expensive, but once installed, it can last up to 10 years. And this will help the institution from cutting costs and constant repairs. And that is how you can clarify the misconception or beliefs to the institution. Implementing strategy, involve them in coming up with the solution to the problem. Give them option, give the institution option so that it can be able to come up with be able to implement whatever you are suggesting. Evaluation of the intervention. Identify the indicators that show the problem has resolved. The water bills. Has the water bill been rising? Water bill has been rising because of leakages. There have been constant problems with electricity because of the quality of the wire that was used for wiring. So what will be the indicator there? The indicator can be water bill. The water bill, the indicator can also be electricity bill. So you can now say, let me analyze how much electricity bill has been there after changing the wire. Is the electricity bill and constant interruption of power supply within the institution reducing? And that will help you to understand how, will help you also to defend yourself. The next thing is quantify the problem of the intervention. Then you can say before and after the intervention. Before changing the electricity wire and after changing the electricity wire. Is the electricity bill still the problem? Are there constant? How many interruptions? Are the electricity interruptions still there or they are not there anymore? Reporting your finding. Reporting your finding, you have to report your finding by break. Of course, yeah, there's a problem you have analyzed. And I think I will leave you here most of the time. How do you do your report? How do you do your research report? Of course, one of the ways you can do your report, and at this level, I will not want to bother you so much, is that one of the ways that you can do your report is doing a problem analysis. Problem analysis, that means that you are breaking a problem into smaller problems. Then you collect your data. Of course, you must have collected to say that your water bills have been this way. Then you analyze your data, and then you say the electricity bill is falling down because I've changed the electricity wire, put the bright quality of the electricity wire. So there's really a very big change. Then you can have your discussion and conclusion thereof. But in terms of reporting, we can have a lot of flexibility here. And I'll be very happy if you can read more on how do you do your reporting, how do you do a comprehensive action research report that can help you to come up with a nice report that can go to the institution, and the institution realize that it is indeed you have helped it to cut some cost here and there, and you have helped the institution run its services efficiently within the specified time. So that marks the end of my report, my discussion today. But I'll give you some tasks so that you come up with how do you do your report? How effectively, how are you going to do your report so that your report can really be understood by the management? And I want you to really read more on this and tell me in the end when we meet again, and then be able to explain to me in a very good way how do you write your report, But one of the things I've given you is one of the key points is that you should be having some problem analysis, and you should have collected data, and probably you should do other things that you should tell me later on. Have a nice day, and in case of any question, any misunderstanding in my discussion with you, please, you know how to reach me. But this is just one way of making sure that you understand some of the concepts now that the corona pandemic has taken over. But once we meet, and maybe if you have a problem, you can chat to me on my WhatsApp, and then we can help each other from there, so that you understand really how and why action research is very important to health system support management as a profession to you. Thank you.